Hello, um, my name's Beth Clarke and this is Dr. Rachel Harrison. We are both craniosacral therapists and we're based in Edinburgh. We trained with the Upledger Institute, so we're Upledger Craniosacral Therapists. And this is an interview between myself and Dr. Rachel here. I'm going to be asking her some questions about being what it's like to be a GP and a craniosacral therapist. And I'm fascinated about how the two complement each other. So I'm going to be asking Rachel some questions about that. So if you'd like to introduce yourself, Rachel.
So, hello everybody. I've been a doctor for just a bit over 40 years and I've been doing craniosacral therapy for 30, and I do 2 days of each and have done for 30 or so years. I work here in Edinburgh, and I find that both of them complement and inform each other and also provide a wonderful balance of speed of practicing, I suppose. So that's one of the things that's particularly nice about doing both.
Okay. I guess the first question to ask, and the first thing that maybe watchers, listeners would like to hear is what is craniosacral therapy? There are various ways of defining it. How do you define it, Rachel? What is it?
So with Upledger Craniosacral Therapy, this is a form of gentle soft tissue healing work that can be used for a wide variety of problems. We work on the whole with you lying on the couch and with all your clothes on, and we work on the whole body and really do everything we can to promote your body's own innate self-healing abilities, so that we don't have to know any of the answers. We help you relax and find a way with our touch and support, so that your tissues themselves show what is required. And it may be that at some stage images might come to you and there might be a little bit of discussion. I use that word slightly hesitantly, but a dialogue between sensations in the body and perhaps one's more intellectual mind. But really it's about giving the opportunity to your body to speak for itself, both in a physical sense and also perhaps using some words occasionally.
Yes, giving the body an opportunity to speak for itself is a big part of it. I've sometimes thought of it as a kind of almost like counselling for the body, if you like. That it kind of gives the body that opportunity to tell its story, and it can be such a powerful tool for healing tool because of that. Okay, so the next question, so just following on from that, so what conditions might craniosacral therapy help with?
So if I was in a GP consultation, I might recommend that people thought about craniosacral therapy if they had a problem that wasn't responding to more conventional treatment methods. And this might be something like musculoskeletal problems, neck pain, shoulder pain, back pain. It might be headaches, it might be unsettled babies, or dealing with chronic health conditions which are impairing one's ability to function in life generally, perhaps both from a physical and also psychological or emotional level.
Okay, yeah. Right, okay, yeah, so these kind of conditions. And my next question would be just to sort of talk about yourself and your journey. So I'm interested to know if you could, well, just give us a bit of background about how you came to be a GP and a craniosacral therapist? How did that come?
I came from quite an unconventional family, and I rebelled and did medicine. Is the how I like to start off. So I wasn't going to have any of that nonsense. And then, of course, having got all my medical qualifications and qualified as a GP, I reverted perhaps to my family type and started exploring complementary medicine. I always wanted to put my hands on bodies, and as GPs, as you'll be aware, you don't touch people very much, and I loved the thought that I might be able to do something useful with my hands, not just with medication, for example. So I became a homeopath first because there was a very wonderful homeopathic hospital and doctors in Glasgow where I was working, and then I heard about craniosacral therapy, and the Upledger School really appealed to me because it's got a very good structural basis and anatomical explanations for everything, and it just was a very nice way for me to venture into the world of touch, which was quite new to me.
Wow. Okay, that's not what I expected. That's interesting to hear. So, okay. So yeah. So I mean, I think you've more or less answered this question actually about how your work's divided up. I think you did say it was 50-50, is that right?
Well, not really, no, because I do 2 days of craniosacral therapy, and in that time I might see 5 patients for an hour each. So the whole day might take 6 or 7 hours, including a lunch break, whereas my GP days are more like 10.5 hours with a snatched coffee or a sandwich. So hours wise, no, but in terms of 2 days of each, yes. Yeah. And that's always been a nice balance for me.
Okay, yeah. I mean, that time that we're able to give as craniosacral therapists, that GPs just don't have the time to give. So an hour, and we are treating the whole person. So that is a precious thing, isn't it?
And I suppose one of the things about being a GP is that a lot of my craniosacral therapy patients will ask me questions about their general health. They will make use of the fact that I'm a GP. I often find myself helping patients navigate how to get the best out of the NHS, which is not at all straightforward, how to understand what doctors have been telling them, how to understand what advice has been given and what that might even mean to them personally. So because I have the luxury of spending an hour with each person, we can use that time however we want, and it may not all be spent on the table, especially if someone's navigating, for example, difficult decisions about cancer treatment or any kind of chronic health condition, chronic pain, medication questions. So there's often a lot that I might be able to address. I'd be saying pretty much exactly the same things as I'd say as a GP if I had an hour to spend with the patient, which sadly doesn't happen.
Yeah, wow, that's great. Yeah, that must be really useful for people to have that time and that extra sort of help and support.
Yeah, and sometimes patients will choose to come to me specifically because they know that I am a GP, and so I have a foot in either camp, and I can perhaps help with that translation business, as I mentioned.
Yeah, that's a great way that the two complement each other, isn't it? For sure. So yeah, I was going to ask, I mean, along those lines, I suppose you have kind of answered that. I said, my next question was going to be, do you ever combine the two in one consultation, which you've kind of answered, really, I suppose, because it would presumably be difficult to bring CST into a GP consultation.
I used at one stage to actually treat babies in my GP setting. When we had the midwives, the health visitors working in our surgery, they might often have recommended a mum bring her baby to me. And because babies can often be treated with just 20 minutes, I could score off a double appointment and do a little 20-minute treatment on a baby. So that I used to do quite a bit. Also, I would say that my craniosacral approach definitely informs the way I practice medicine. And it will may inform what treatments I recommend, or just perhaps how I help people understand why their body is manifesting specific symptoms and how that might be related to their previous life history and previous life events. So I think making sense of why one's body is behaving in a certain way is something that all therapists and doctors do their very best to address, and that's that's a real art form. And craniosacral therapy has undoubtedly helped me understand why the body behaves in certain ways, why we all manifest differently, and how to listen to our own wisdom, our own bodies, and what they're trying to tell us.
Yeah. Okay.
I'm going to take a little aside because something's just come to me. One of the things that one of our uploaded teachers used to say is give the patient some homework, but don't give them homework. Ask them. So if we've been working, for example, on a painful shoulder, I might say at the end of the session, I might say, if your shoulder could borrow your voice, what would your shoulder really like you to do a bit more of or a bit less of in the next week or two? And that's a technique that I might use at the end of a craniosacral therapy session, but that only takes a few moments to say. So I might also say some similar words in a GP consultation, for example.
Right, that's a great question. Yeah, and then to just leave that open for the shoulder to speak. Yeah, good question. Excellent. Okay, right. Next thing I was going to ask is, so I was going to say the two, so we've talked about how they complement each other, but they are two very different approaches, aren't they? So I'm just wondering if there are any ways in which they conflict.
I suppose we're usually looking for a quick answer in general practice for time reasons, and a lot of patients who come and see us, they'll have been told a million times, stop smoking, lose weight, take more exercise, and they've got a chronic pain. They just want a tablet to take the pain away. And of course, if we've got really distressing symptoms, we just, please, could you just take this problem away from me? And in general practice, we get very caught by that way of trying to respond. And if we can, if someone comes to me with dizziness and there's a medication I can give them for dizziness, I'm going to say, okay, we tried this or that maneuver, that hasn't really worked, so do you want to try these tablets? And that's that's a nice thing to be able to do. A lot of people are absolutely delighted. There's some incredibly effective medications around for all sorts of conditions, without which half of us would be, well, we certainly wouldn't make it into our 80s. I've lost sight completely of what your question was.
I was asking about, are there conflicts?
Do they conflict? Yeah, well, not really, not in essence, but one of the things that really annoys me about general practice, that I spend a lot of time prescribing medications which I don't have a huge amount of confidence in, but the NICE guidelines say that we ought to recommend this treatment for this condition. So I find that a little perhaps off-piste in terms of what I'm most interested in.
Okay. So yeah. Okay. Yeah. Okay. Right. Right. Okay. I mean, you've said a little bit about treating babies as well. I was going to ask you, it's because craniosacral therapy is, well, probably best known as a treatment for mothers and babies, I think. And I was just going to ask you if you could tell us a bit more about your work with these clients, but you kind of have already. But is there anything else?
Working with babies is an utter delight, and baby systems are so fluid and so so uninhibited, that if you take a hold of any baby, the body will move, it'll twist, it'll unwind, it'll unravel, it'll stretch. And a lot of craniosacral therapy is about facilitating that movement. So a baby might come in, for example, with quite a flat head, and it's because they're always sleeping on the one side of their body, because their neck is a little bit tight, and so they're always sort of prefer to turn this way or that way. And if I'm holding the baby in my hands, I may well just follow whatever maybe the tightness is pulling to the left, and I might just accentuate that pulling to the left, and then it'll show me something else, and then it might go this way or that way or the other way, and eventually then it might do a huge stretch off to the right. And so this is following the tissues. We're following what the body is showing, and we do this exactly the same thing with adults. So it's easier to do in a swimming pool with adults, because when you've got several people holding the patient, which is also a form of treatment. But with babies, you can just do it with the one person and follow these movements, and then there's a form of unlatching that happens. So maybe the baby's neck is a little bit turned this way because it was something a little tight or restricted. We don't need to know that. All we need to do is follow and let it go even further, maybe even further, maybe even further into that sore place. And then the body, the neck the baby will find a different way and actually release a little bit of that tightness. And then you'll find that they have a wider range of movement and a little bit more comfortable turning other way. And so the baby is not always sleeping this way anymore. So does that answer your question? Anyway, so that is an example of one thing. Treating babies is a delight. Often there's been quite a difficult delivery, and the mum may also be quite anxious and distressed and stressed about the baby being uncomfortable or not sleeping, or so often just giving some really quality listening and space for both the mother and the baby, and watching and facilitating their interaction, and just really encouraging, because most mums are doing an amazing job, but maybe lacking a little bit in confidence, and often even just showing the mum how nicely she's holding the baby, and how already instinctively she's allowing the baby to take up the positions that are comfortable for them, and just that facilitating that connection between mum and baby, or dad and baby, or even sibling. We can, it's delightful. You can work with the whole family. So, often the 2-year-old will also be there, and you can encourage the 2-year-old to also put their hands on, maybe on mum. So you might say, why don't you put your hand on your mum there, and I'm going to hold the baby, and I'm going to hold all 3 of you, and then I might have my hand on the 2-year-old. So it becomes a whole kind of, I don't know, it's sort of a healing thing that then happens between that mother, baby, child, you, father, granny unit. And so wax too lyrical about that, but it is
beautiful. Wax away.
It is a very nice way of working, and a lot of babies do extremely well, often 2-3 treatments, and the sleep will settle, the tummy, the colic will settle, the flat head will start to maybe to be less influenced by the baby's head position, and therefore the skull then just reshapes itself nicely.
Yes, and of course the process you describe of how the baby going into the pan and going right deep into the pattern, and then the release comes. That is how we work with adults as well, actually.
So we'll be doing exactly the same with the person who's got the sore shoulder. We'll be supporting the arm, and if the arm is relaxed enough, then the arm will find its own unraveling and unwinding and release.
So there's a lot about the trusting of the body.
So going right into the restriction and just hanging out there for long enough to the body to actually show my shoulder. It's like, well, it's like it's here. It's like, well, let's go even more here, and then it's like, oh, okay, then something else happens, and you don't need to know. Your shoulder's going to tell us. So I don't need to know. You don't need to know. It's about following the tissues and this rather lovely thing that happens. It's a bit like yawning. When we yawn, we stretch. We don't think I'm going to lift my right arm up and my left arm out. We just do it. And craniosacral therapy is like accentuating that instinctive movement and need to stretch in a certain way.
I mean, it can be counterintuitive in the sense that you would expect, in order to release say if the head's tending to go in one direction, that you would want to try and get it to go the other way. But actually, it's the opposite is the way we work. That the body goes further into the restriction in order to then
unlatches whatever it is that's causing the problem.
So it's a way of working that where you might, when you first hear that, go, oh, that's maybe not what you might expect. Great, okay. So just what's the next question I was going to ask? I was going to ask a little bit about because in the Upledger Institute we are currently gathering case studies to provide more of an evidence basis for craniosacral therapy, and I was just interested to ask your thoughts about this. I mean, I have kind of wondered sometimes whether craniosacral therapy can be evaluated in this way because it's a holistic approach. What are your thoughts on that?
If we're trying to follow the conventional study research model where we're doing placebo-controlled studies, it's not so easy. It's not impossible. You can't have a double blind, so you can't pretend that you're doing craniosacral therapy and not be doing it. But you can have two groups of patients. For example, you can have someone who has you can have a group of patients who have headaches, and you can monitor their symptoms, all of them, over a period of 6 months, and you can give craniosacral therapy to half of them for the first 2-3 months and to the other half of them for the other 3 months. So there are ways of doing research. We're hoping to start a research into patients with concussion, perhaps in the next this year. There have been a lot of research done in patients with PTSD, Vietnam War veterans, patients with autistic spectrum disorders. So there's a fair amount of evidence out there. We're also collecting case studies at the moment so that there is a better idea of what it is we're actually doing with people and how that might be useful and what sort of conditions we can help.
So the aim is to focus on specific conditions.
On the whole, with research, you're looking for treatment for a condition. You don't say, is craniosacral therapy a useful thing? You say, is craniosacral therapy useful for babies with colic, or people with concussion, or people with sore necks? There is a multi-practitioner outcomes study where we looked at 135 patients and just treated for a wide variety of problems and looked at the outcome for different conditions. And one of the nice things that I was able to demonstrate with the ones I was seeing, because I had their general practice notes, is that I was able to document a 50% reduction in GP consultations in the 6 months following treatment, which I thought was Very nice. And that was consultations for all conditions, not for the condition they were presenting with.
Yeah, that's interesting.
And I think that what that shows is that if you attend to the body, you're not just attending to your sore neck or your headaches, you're attending to the body. The body is showing you what you need, and hopefully you come out of your session or sessions with a better understanding of what you need for your life to be well.
That's certainly been my experience as a client, because I first came to Craniosacral Therapy as a client, and that's certainly been my experience of it. I went with a sore shoulder, and my sore shoulder led me onto an amazing healing journey through Craniosacral Therapy. So yeah, it's a powerful thing. Although the touch is very light and gentle, and if you come for a session, you might not even feel that there's anything going on. It's quite subtle, but it has powerful effects, or can have. Okay, there was one more thing I wanted to just have a chat with you about, Rachel, which was to talk about, because in Unlatching Craniosacral Therapy we use a range of techniques, or a particular approach that's called Somato emotional release, and this is what we use to address old trauma that might be in the body tissues that's sort of inhibiting the body from functioning at its best. And so I just wanted to ask you about your work with Somato emotional release, and how you work with that, and how that is for you.
So I don't make a distinction whether I'm going to do craniosacral therapy or somato emotional release, as we call it, SER. I don't make a decision as to. So sometimes patients will come and they've said, I've heard about this thing, SCR, that I want that. But on the whole, I work on the body, and I listen as best I can with my hands, with my ears. I listen to what the patient has told me before they've got on the table, comments they might make while they're on the table. Sometimes I might, for example, put my hand in a certain place, and I might notice that they're crying, that tears come, or that the body starts to do some great big kind of expressive unwinding thing, and I might say, well, what's going on there? What are you aware of there? Or what's come to where are your thoughts just now? And so sometimes we can enter into a dialogue with a symptom or a pain or a sensation or a part of the body, and allow that part of the organism, if you like, to express itself using the patient's voice. And sometimes we end up with a conversation between, the head might be saying one thing, the grandmother might be saying, you shouldn't be talking all this nonsense, the shoulder's saying, I'm really sore, and we can have all sorts of very extraordinary revealing conversations with the body. But the great thing about craniosacral therapy is that it's very slow, it's very quiet, and it's very anchored in the physical. So if I get the impression somebody's starting to get very caught up with their thoughts, then I can say, oh yeah, but just can we come back in here again to just what is this bit? How's this bit doing with these words you're saying? So hopefully it brings a kind of a balance to an emotional piece of work. So the somato emotional release, it's about allowing the body to have its say, and the emotional context to actually come into the physical sensation of an emotion in a really deep, patient, unstructured way, with no agenda. Just what is it actually like to be in pain or crying or grieving or whatever comes, and stay with that until something changes. Might be a tiny wee thing, but it's anyway, it's a delightful way of working that helps bring the emotional content of often very significant content of especially long-standing health conditions into the agenda without it becoming an ideas sort of sidetrack. So keeping it rooted in the body, so the body can give us advice and can come up, for example, as we started at the beginning of this exchange, with a little piece of homework. It's like, actually, Beth or Rachel, I would really like you to rest a little bit more, to go swimming a little bit more. I've no idea. It might be anything. To speak to your son about something. Could be anything at all. Yeah. And again, I don't need to know. You don't really need to know, but we will find some answers. Sometimes, often.
Yeah, and it can be that emotional piece is the missing piece, is the piece that you need in order to heal something chronic that just keeps going and keeps coming back. Sometimes it is, might not be that, but sometimes it can be that, and it's a very gentle and really supported and held way of meeting that part of you and then letting it go so that you can then.
And Dr. John Upledger was inspired really in developing that way of working, which I really respect and love. It's
me too.
Perhaps one of the most important aspects of the treatment of this work.
Yeah.
Thank you, Beth.
That's a lovely place to end. So, yeah. Thank you, Rachel. That was wonderful, and I loved hearing about your work with babies. That was really lovely, and yeah, your somato emotional release work and all the other things you've told us about. So, thank you so much. Thank you for making the time, and thank you for watching. So yeah, if you have any questions, feel free to contact us or contact me or either of us. And yeah, we hope you enjoyed. Bye for now.
Thank you.